Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health, one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode, and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome back to another episode of the Things I Want My Daughters to Know podcast. And today I am so excited by our guest because I know that we're going to get really deep into the conversation about women's health, especially menopause, really trying to understand what is going on in this menopause conversation, the really important things that women need to know, maybe some of the things that are being spoken about that we need to really use our thought process, really to understand what is really all this wealth of information that is being shared. But the person I have today, Dr. Anna Garrett, really is been in this space for a long time, and I'm so excited to have you with us. I'm quite a fan. I've been following you on social media for a long time. I get your newsletter, which I recommend everyone sign up to. And Dr. Anna, welcome to the podcast. Tell us a little bit about who you are, what you do, and we're going to get right into it. I know we're going to have a lot to talk about today.
Well, thank you for having me. I know we've been chasing each other around for a year or so, so never quite made it to the summit, but here I am.
Yeah, well, I'm happy you're here today.
Well, I'm happy to be here. So I have been working in the hormone space for 14 years. I'm a pharmacist by training, doctor of pharmacy, and I have worked kind of in every practice setting you can possibly imagine. And in 2011, I started this business because I wanted to be able to use my pharmacist training. And I'm also a certified coach. So I wanted to bring all of that together to help women who were in perimenopause because that's where I was at the time. My last official job, I was doing wellness coaching at our local hospital. And most of the clients I would see were women who would come in and say, I'm going to turn 50 next year, and this and this and this is going on. And I'm like, wait a minute, there's something here. And so this is before I even went down the hormone rabbit hole.
Yeah.
So I took the deep dive. I started working in my business full time in 2017. And it's been quite the journey then, especially just from watching all of these people now who are suddenly in the menopause space when there was
Yeah.
virtually nobody in 2011. So,
Yes. Yes.
as you said, there's a menopause coach on every street corner in the UK. They're pretty much that way here too. And um, I, you know, the degrees of knowledge and what is shared vary a lot in quality, in my opinion.
Yeah.
So, who do you listen to? And that's one
Yeah.
of the big tricky areas for
Yeah.
women is who do you listen
Yeah.
to?
So maybe let's start there because you and I have both been in this space way before it became hot topic, way before Oprah was
Mhm.
doing her, talk shows
Right.
about it, way before in the UK, we had a couple of documentaries also. And we've seen this space change. We've also seen the hormone conversation change. And I know that
Right.
there's so much for us to really dig our teeth into, but maybe let's just start from the beginning. Um, as a perimenopause, menopausal woman, we are now exposed to so much information. So, how have you seen things change in terms of obviously, we know the space has exploded, but in terms of what the regular woman on the street, the woman who is actually going through it, how have you seen her experience change, or her exposure or her access to information, knowledge, resources change? Maybe that's sort of a good place to start. Not sort of what has changed from the content side, but for the actual lived experience of the woman.
So that's actually a really interesting question, and I'm glad that we're going to talk about it because, in 2011, you didn't bring up the topic of menopause anywhere, not with your friends, not at the dinner table, not anywhere. And so I think what the best thing that has happened with all of this increase in knowledge is that women now have the resources to go to educate themselves and be able to have uh, an informed conversation with their healthcare provider without having to have a medical degree. So, when I wrote my book, I wrote it in a way that I thought would be accessible for women to be able to read it and go, oh, I can do these things. These are the questions I need to be asking.
Yeah,
So I think we now have a much more informed, in general, population than we did, say, 10 years ago. Now, what is that information that's being shared? Well, it's coming from nutritionists and coaches and acupuncturists and physicians and pharmacists, and everybody has some thoughts about this. And I guess my biggest, it's not really a complaint. My biggest concern is that you have some very, very loud voices
yeah,
who are in this, well, it's not evidence-based camp. Well, so, okay, if it's not evidence-based, has something actually been studied? And that is my biggest gripe
yeah,
because there's a woman in Canada who just is like, you know, if the FDA or there's no studies with something, that means something can't possibly work.
yeah.
Well, I've seen too many, N of ones,
Yes,
your own study
yes,
where things do work and they do help.
yeah,
And so I think to dismiss things out of hand because there's not some randomized placebo-controlled double-blind study is
yeah.
just a mistake. And I
And
also,
also, we know that there is such little research done in women's health. It's such
correct.
an ironic thing to say, well, there's no evidence-based information to prove or disprove that, you know, you know, uh, we can treat symptoms with X, or, Y doesn't work, or you've got to go for Z, because there is not enough research. There is not enough
Right.
evidence-based
And
information.
and then the whole issue of compounding pharmacies. Well, so a compounding pharmacy can make you a customized dose of a medication that may serve you much better
Yeah,
than what is available commercially.
yeah,
And yet we have these physicians out there saying, oh, no, it's unsafe. Don't
yeah,
do it. It's not regulated. Well, I don't know about in the UK, but compounding pharmacies in the US may not be regulated by the FDA, but they got a whole other set of regulations they have to deal with.
yeah.
And pharmacists are professionals. They're not going in the back room of the pharmacy and whipping up some witch's brew and sending it out the
Yeah,
door.
yeah, yeah, I know. And that is definitely part of the challenge as we open up this conversation. As you correctly said, there are some very loud voices who definitely may know their stuff. It's not that they're, not being truthful and honest in what they're sharing, but it's only one piece of the puzzle of this whole menopause experience. But
Right,
they seem to be getting a lot of attention because either they have a lot of, good people working behind them, or some, good money put behind them,
exactly.
or they're just very good at, being able to curate a message. And and then women are like, well, I've heard this influencer say this, and so I'm going to go on with that in that direction, and maybe it works, maybe it doesn't work. But there's no
Right.
space there for looking at other not conflicting, but different opinions or different views. And I think that N of one is a really important thing to
Hmm.
stress on. Can you just expand on it a little bit if our listeners don't understand what that N of one actually means?
Sure. So when studies are designed, like randomized studies are designed, they figure out how many subjects they need to have to show the clinical difference that they're trying to show,
Yeah,
or the side effect, or whatever it is they're trying to prove in the study. And so N equals whatever is what is in the study, right? So the number needed to treat or whatever. And so N of one means that you are your own experiment.
yeah,
You're not in a bunch of people. You are going to try different things
yeah.
based on your um,
I
see,
think like your lived experience, what sort of how
well,
you
your
respond to
lived
something.
experience, the research that you do, does this feel right to you?
Yeah,
So let's take hormone therapy, for
yeah,
instance. There are many, many women out there who do not, for reasons that may or may not be true, want to go down the hormone path. Hopefully, that decision is not based on fear of a study from 2002,
yeah,
but they just may have their own reasons for
yeah,
not wanting to do that.
yeah.
And so th- that's that's a personal decision. It's all very personal. So you, as your N of one, wanting to avoid hormone therapy,
Yeah.
will then have to do some research about, okay, well, what are my alternatives?
Yeah.
And I always have people start with lifestyle, because you cannot out supplement or out hormone a terrible lifestyle. You just can't. So you
Okay.
have to start there.
So I'm really happy you brought this up. Let's go into that because I agree with you 100%. And my analogy is you can take as much HRT as you want. But if you are not looking at your stress, your nutrition, your lifestyle factors, all these other things going on, it's like pouring water into a bucket with a hole in it. You may feel
Right.
good for a little bit, but at the end of the day, you're still going to have those factors that keep pulling you out of balance. So, share with me your perspective on this whole lifestyle piece because people will turn around and say, yeah, okay, fine. I know I've got to eat healthy. I know I've got to exercise, but, yeah, I'm sort of doing it, but I'm busy. I'm just taking the HRT. Isn't that enough? So, tell me how you understand and how you view the whole lifestyle piece of this.
So, my personal opinion is that stress underlies every hormone balance in the body. And that's because cortisol, one of your stress hormones, is the only hormone that your body needs to live. It does not need estrogen and progesterone and testosterone to live.
Yeah,
And so it will take all the raw materials for your sex hormones
yeah,
and shove them into the cortisol production pathway at the expense of everything else. So you're right. It is like pouring HRT into a bucket with holes in it, because it's going straight into that cortisol pathway. And I
yeah.
wish I had a diagram of how the hormone cascade works.
Yes, yes.
Um, but
Anyone
there's
who wants to understand, go Google hormone cascade and you'll understand what Dr. Anna's about to say to you.
Right. So everything comes from pregnenolone, which comes from cholesterol. So that's another point. We're trying to lower people's cholesterol to nothing. Well,
Yeah,
what does that do to your sex hormone production?
yeah,
And we don't really know the answer to that.
yeah,
Cholesterol, pregnenolone, and then we go into progesterone on one side and DHEA on the other. And then progesterone can be made into cortisol.
yeah,
DHEA gets turned into estrogen and testosterone
yeah,
and its metabolites. So that whole right side that I just described, if you're under great stress, nothing's going over there.
yeah.
So
Everything's
your
going
hormone
into the progesterone cortisol.
cortisol,
Yeah,
right.
yeah,
So to me, stress management is priority number one.
yeah,
What
And
does that
I
mean?
just don't think women realize this. They know, yes, I've got to de-stress. Yes, I've got to do meditation. Yes, I've got to do all these things. But I don't think people realize how profound that cortisol hormone is. And when we talk about
Right,
hormones, this is the other thing. I'm sure you feel the same way. But what bothers me the most is when we talk about hormones in women's health, people assume we are only talking about reproductive hormones. There
right,
is a massive, very intricate, very detailed and complex hormonal system that includes the reproductive hormones, but includes lots of other hormones, and they all interconnect with each other. So when we're
exactly.
talking about hormones and, doctors don't want to test hormones and we don't want to look at hormones and hormones are fluctuating, can we please be specific? Can we please use the appropriate language and talk about reproductive hormones and then talk about all the other hormones and how they're being impacted?
Well, you mentioned testing, so I could have a whole big rant about that as well.
Yes.
Um, of course, hormones fluctuate. There's not a lab test that you go and do where it doesn't fluctuate like in 10 minutes.
Yeah.
And yet we still use those to make clinical decisions on. Um, so I just, if we have time, I'll go there. But
Yes.
yeah, so like insulin is a hormone. Leptin is a hormone, ghrelin, vitamin D is a hormone. So
Melatonin.
they
Yeah.
all play together. And so you cannot operate in a silo. And so, one of the things I've spent a lot of time thinking about in the last year or so, because I got my functional medicine certification, and so I've moved into gut health and autoimmunity and a lot
Yeah.
of
I
other
know
things.
you write a lot about that.
So now I'm moving into helping women create longevity plans, which cover all of that waterfront.
Yeah.
Because I'll be 66 in a couple weeks. And so I'm like, I'm not perimenopausal anymore. I'm not my ideal client anymore, but I sure as heck want to live the best life I can live with whatever I've got left.
Yeah, definitely.
So that's my latest thing. But stress management really takes the form of whatever it is it
Yeah.
takes to center you. And I think some people don't understand what can be stressful. So I'll give you an example,
Yeah.
of something that's just that nobody would think about. Being in an air conditioned building all day long is stressful to your body because
Wow.
back in the day, when we were cavemen, you were exposed to variations in temperature. Well,
Temperature.
we're all at like 72 now, all day long, or whatever that
Yeah.
translates into Celsius. Um, and that is stressful to your body. It's not a normal situation to be in a space that is a constant temperature. Winning the
Interesting.
lottery is stressful. It's good stress, but it's still stress.
Yeah.
And so people just don't think about that.
Yeah.
They don't think about, oh, if I'm exercising 5 or 6 days a week, that's got to be good for me, right? Wrong.
Yes.
When you're in your 50s and 60s, your body can't take that
Oh,
level of effort for
yeah.
most people. I'm not going to say everybody,
Yeah.
but over exercising is a thing, under eating is a thing. All of this is
Yeah,
stressful.
the whole calorie counting thing
Yes.
as we age adds more stress onto our bodies. So, um, so as we understand perimenopause, menopause, and now sort of what we're all looking at is postmenopause and creating these really healthy, long, longevity plans, or really creating that sort of focus of healthy, long living. I know you and I know it doesn't just start at 40 or 45 when you enter perimenopause.
Um,
So this is sort of where we begin to talk about life, our sort of life stages and what we need to be learning as women from before perimenopause that is already going to set us up for the type of perimenopause, menopause, and postmenopause that we really want. So tell me a little bit about what women need to know before things start going a bit, disruptive in our bodies.
well, the first thing they need to know is to pay attention.
Yes, yes, yes.
Because how many of us in our 20s and early 30s are really paying attention to our bodies? Not very many, unless you're, having a baby, and then you're probably paying a lot of attention to that.
Or the only other time is if you are trying to get pregnant. It's
Exactly.
all your health in those fertility years really is about, do I want to get pregnant? Can I get pregnant? Am I pregnant? It's really a siloed conversation around
Right.
reproduction and fertility.
So once you hit your mid 30s, perimenopause can start to creep in. So if you're experiencing new symptoms, like you've never been an anxious person and suddenly you have anxiety, you've always been a great sleeper and now you're not, your periods look like a crime scene, those are all clues that something is changing. It's not just random. And also, I would love it if women would, really start to think about bone health and cardiovascular health and brain health in their 30s,
Yeah.
because my friends, those things don't get better as you age unless you're
Yeah.
tending to them.
Yeah.
And
And and
so,
and can I push you on this? Um,
mhm.
because there is now a common narrative or a populist narrative that women, as we age, the only way to protect our bones, brain, and heart is to take HRT. HRT is the only way to protect those three critical systems as we enter postmenopause and as we enter, aging. Can I ask you what your thoughts are on around this, especially because you're saying that already at the age of 35, we need to be proactively thinking about these key systems in our body?
Well, so your bone density is at its highest. I believe it's in your early 30s.
Yeah,
So if you are in your early 30s, if you are lifting weights or doing weight bearing exercise, you're taking your vitamin D with K2,
yeah,
you've got a healthy diet that's got lots of leafy greens and maybe dairy if that's your thing. You're probably doing what you can do to maintain your bone health. I know, at least in the US, the insurance system here doesn't recommend a DEXA scan until you're 65. I'm like, what the hell is that? The horse is out of the barn. I mean, the horse is like
yeah,
gone by the
yeah.
time you're 65,
Five.
because
Yeah,
as your estrogen levels start to fall, your bone density decreases quite a bit and
yeah.
very rapidly as you hit menopause. So is HRT the only answer for that? No.
Thank
You
you.
can you can do the things that I just mentioned. For cardiovascular health, eating a healthy diet. I'm not a plant-based fan. Some people are. I think it's, well, is it difficult to get enough protein? Maybe not. But the things you would have to do to get protein are not things that appeal to me. And just because they don't appeal to me doesn't mean they shouldn't appeal to you. So, but staying on top of your cardiovascular health numbers. So, is that just a cholesterol panel? No. If your cholesterol panel is out of whack and your cholesterol is high, it means doing a deeper dive into some advanced lipid testing to see what kind of cholesterol particles do I have. It means getting a coronary calcium scan, which is very inexpensive, but it'll show you how much plaque you already have in your
Yeah,
arteries. So you want that to be zero. And just making sure that you're staying on top of those
yeah.
things. Um, and then for brain health, I mean, I started taking piano lessons when I was 50 again for the third time,
Okay.
because that's my Alzheimer's prevention strategy.
Yeah,
And so keeping your brain active,
yeah,
making sure that you're not isolating yourself, eating healthy, movement is a major part of maintaining your brain health.
yeah,
Knowing whether you have the ApoE4 gene, which is puts you at a lot greater risk for getting Alzheimer's, but it also gives you some lifestyle interventions like really, really limiting saturated fat and that kind of thing to help maintain your brain health. So
Yeah.
I also do genetic testing. So it's more
Interesting.
along the lines of, lifestyle genes and
Yeah.
what can we do epigenetically to keep you from turning on the bad genes that you happen to have. Now, having said all that, I'm on an estrogen patch and I take progesterone and testosterone, and somebody will have to pry it out of my cold dead hand because it helped my sleep so much.
Yeah.
Um, and I had osteopenia when I started, and I was already lifting weights 2 or 3 days a week,
Yeah.
and I eat well. And I was like, what else am I going to do?
Yes.
Um, I have a horrible family history of breast cancer.
Right.
And so I went to my doctor and I took her the book, Estrogen Matters, which
Yes.
everyone should read if you have any fears about
Yeah.
estrogen, know what the data says. And I said, here, please read this. She's like, I'm very uncomfortable prescribing this. I'm like, you know what?
Yeah.
Do it anyway.
Yeah.
So, um, so she said, okay, I'll make a deal with you. You get mammograms twice a year and, we'll do that. And that's been at least 2 years ago.
Yeah.
So,
But I want to maybe use you yourself as your N of one because you're doing all the things right. And you are proactively engaged in understanding how to support your bones, brain, heart, and how to really age in a healthy, supportive, nourishing way. And I think nourishing is really, really important word here. But for
mhm,
you, you felt that even though you were doing all those things, it wasn't enough. You needed, maybe I can use the word, a top up with some extra hormones. Um, and again, I am not opposed to that. And I don't think you're opposed to that because obviously you're doing it. It's more if you're only relying on the
right.
HRT to do all the heavy lifting, I don't think that's enough. If you're then going to say, well, I'm on the HRT and therefore I can go and, drink my alcohol,
No.
go out and do whatever I want to do, lead that stressful life because I've got the HRT, it's all fine.
Well, so the way I tell people about the my style of working is that we start with the foundation, which is lifestyle.
Yeah,
We then supplements are the next layer, so things like magnesium
yeah,
or vitamin D or
yeah,
whatever, the foundational things.
yeah,
And then we go to HRT. See, I can't prescribe HRT.
yeah,
So I have to send somebody back to their doctor with
yeah,
recommendations, which for some people creates a whole, another layer of difficulty.
yeah,
Or there are all these online platforms now, which I can send somebody to, and that can pretty much take care of it. But it's not just one thing. It's
yeah,
all of those things together, and that's why I created so I have a vibrant framework, vibrant with an I, not an A. And it's looking at all of those areas. It's keeping your brain active. It's having purpose. It's having community. It's
yes,
intentional nutrition, intelligent supplementation, rest and stress management. But I couldn't sleep, and I had gone the progesterone alone route, and it worked for a while, and then it stopped, and I just was like, I can't function like this.
yeah, yeah,
And so that was what ultimately tipped me over to adding estrogen to what I was doing.
yeah,
And then the testosterone came along later because I'm trying to maintain my muscle mass and all of the things that we want to maintain so that when we're 80, we can get out of a chair and go get on an airplane and go see the people we love or the countries we want to visit or whatever it is that
yeah,
lights us up.
yeah. So let me ask you, because I know that in the UK especially, but in general in the menopause, in the HRT conversation, HRT is sort of a euphemism for estrogen. We
Mhm.
forget that there are other hormones, progesterone and testosterone, and we know there's a lot of discussion about testosterone at the moment. There's a lot of discussion about progesterone, that progesterone is only for women who, if you have a uterus, I know that you have written about that. So let's go into that hormone conversation. We know all about the about estrogen that, if you're going to do anything, you should be doing estrogen. I question that. I think testosterone is something that should be done before estrogen, purely, even if you look at the biology of it, as you mentioned, the hormone cascade, testosterone comes before estrogen. So wouldn't it be really good to support ourselves with the testosterone, and the body can decide how it wants to distribute it? And testosterone, we know, is very, very, for me, this is my opinion, testosterone, I think, can be more supportive because it does a lot of things, and as I said, can be transferred into, converted into estrogen if necessary. And please dispel the myth that you only need progesterone if you have a uterus. So take me down
Uh,
the reproductive hormone conversation.
so, um, estrogen and testosterone actually live on the same level in that hormone cascade, but
Right.
testosterone can be converted into estrogen. The opposite is not true. So, um, it's not really something I like to see when somebody aromatizes a lot of their testosterone into
Yeah.
estrogen because it can kind of complicate the picture. So, I don't know. I think this is where the testing question comes in,
Yeah.
and I think testing levels of testosterone is incredibly important because in women it's so easy to overdo it. I
Yeah.
mean, women will go and they'll be, oh, I want to get a testosterone pellet. They get this pellet put in their
Yes.
butt. It lasts for 3 or 4 months, and
3 months.
suddenly they're sprouting hair out of their chin. Their hair on their head's falling out. They've got acne,
Yeah.
and it's because they're overdosed. So
Yeah.
it's really, really easy to overdose women. Um, here you can either get a compounded testosterone cream, which is
Yeah.
what I have, or you can use a tenth of the male
Yes.
dose. So the little packet where you're trying to squeeze out a tenth of a
Yes.
dose, it's the
Yes.
most ridiculous thing I've ever
Yeah.
heard.
Yeah.
Um, so
Think
there's
I
that.
know things are beginning to change in Australia now. It is changing. There is prescribed
Mhm.
testosterone for women, but traditionally and typically there is no
Right.
FDA approved testosterone for women. In the UK now, it's beginning to change, but we know there are still major, major issues with
Oh,
testosterone
yeah.
access for women. So that I think is one of the reasons also why it's sort of like this double-edged sword, or like this sort of reinforcing thing that testosterone was always the male hormone. People didn't
Right.
think, professionals didn't think that women needed testosterone, so there was no testosterone available for women. And now all of a sudden we're beginning to think that maybe testosterone really is important, but the market hasn't caught up yet. The
No.
information and this evidence-based thing hasn't really caught up with the fact that we know, and I always go back to the biology. I'm less interested in, trying to analyze the psychology of it. Let's just look at what is going on in our bodies. How
Right.
do our bodies work in their most balanced, optimal way? And a woman's body, we know, has more testosterone than estrogen. So that's telling us something.
Right. On a percentage basis, yes. Um, I do want to make sure I talk about this progesterone question because
Please do.
that's the one that
Yes.
makes me crazy. Um, so if you have a hysterectomy and they don't remove your ovaries, you will still make hormones for somewhere probably between 3 and 5 years.
Okay.
But the blood supply to your ovaries generally will get disrupted in some way during that surgery, and then your ovaries will stop working. So those people over there that still have their ovaries are good for a while. The people that have a total hysterectomy and have their ovaries removed go into surgical menopause immediately. So, what does that mean? It means 25% of your testosterone is gone, and your little adrenals have to pick up the slack. And if they're not in good shape, then they're not going to do a very good job.
Yeah.
And so, the party line has always been, from a progesterone standpoint, oh, we only need that for uterine protection. So,
Yeah.
you don't need progesterone no matter which group you're in because you
Yeah.
don't have a uterus to protect.
Yeah.
Well, here's the thing. We have progesterone receptors all over our body. It's
Yes.
our calming hormone. They're in our brain, they're in our nerves, they're in our bones. I mean, progesterone is what makes bones bendy. So estrogen will make them hard, but progesterone makes them resilient.
Right.
And so if you don't have that, then even if your bones are strong, if you sustain a fracture or a trauma, that's hard enough to break your bones are not going to have any resilience and you're probably going to get a fracture. So they're everywhere. Um, and this notion that you don't need progesterone is just ludicrous.
Yeah.
You don't need synthetic progestins, but you do
Yeah.
need bioidentical progesterone. And so the whole term bioidentical, we can get into that. Is it a marketing term? Is it what? It
Yeah.
just means it's the same compound that your body produced when you still had ovaries and you were ovulating every month. Same chemical structure. What they did with the synthetics was add an extra chemical group so that it was no longer like the compound the body produced and they could market it and sell it. So, my friends, in any discussion about hormones beyond what our bodies normally make, the same chemical compound, follow the money because somebody is trying to
Yeah.
sell something and cash in on something else.
Yeah.
So, like prometrium, let's talk about that. It's Utragest, I think, in the UK. It is bioidentical progesterone, but in the United States, they changed the delivery form and formulated it in peanut oil so that they could patent
Um,
it and sell it. So it's always about the money,
money.
literally
Yeah. Yeah.
always about the money,
Yeah. I
which
want to
sounds
just go
very
back also
cynical.
to progesterone because we know that progesterone is very supportive for sleep, for mood disruption, for certain symptoms and experiences that women have. And it's always been bizarre to me that just because you don't have a uterus, but your sleep is disruptive, therefore we're not going to give you progesterone. It
Right,
has made no sense to me. I understand why, again, biologically, the progesterone keeps the uterus the uterus lining intact and not overgrown. Um,
right.
but progesterone does so much more than just keep the uterine lining in check. And
Well,
as
this is why so many women, when they enter perimenopause, they may be able to take progesterone alone and control the insomnia and the anxiety and the mood symptoms with just that alone. They don't need estrogen. They're loaded with estrogen when they first go into perimenopause.
yeah.
And to add more on top of that is just like throwing gasoline on the fire.
So as you're talking, I'm thinking about a client of mine who is 56 and still is in perimenopause. She has not yet hit her full year menopause date.
59.
Wow. Wow. I don't think that's bad. I don't necessarily think that's bad. Ideally, if that's what your body did naturally, then that's
Yep.
amazing. She's 56. She is still struggling with a lot of symptoms. I sent her eventually to a bioidentical HRT expert that I send my clients to because, yeah, as you said, we can't prescribe HRT. What did the bioidentical HRT woman say to her, specialist say to her? Your progesterone is menopausal levels, but your estrogen is perimenopausal levels. There is such a difference between the estrogen and progesterone. And she had tried traditional HRT, the patch and everything. That estrogen is going to spike the ratio between the estrogen and progesterone even more. What she actually needs is only progesterone support.
Correct.
Doesn't need any estrogen support, and that's the standard when they say, as we said at the beginning, HRT is euphemism for estrogen. She doesn't need estrogen. She just
Right.
needs to boost her progesterone levels to help with her symptoms. Whenever she hits menopause, she'll hit menopause. But in the meantime, and you only know that if you test. And going back to
Correct.
the testing element of it, I'd love to hear your thoughts because there is that other
Uh,
myth we want to bust that doctors say no point in testing, hormones are fluctuating, we won't get any reliable data. But take your estrogen patch and and you'll feel fine. Forgetting about the fact that maybe you're estrogen dominant, maybe the ratio between estrogen and progesterone is large enough already. Maybe, 101 different things are going on. Maybe we want to test your vitamin D levels, your magnesium levels. Maybe we want to look at cortisol. Maybe we want to look at other things. So jump on your soapbox and tell me what you feel about this.
So well, you already know what I think, but I'm going to tell you.
I know, but the people
Um,
listening don't know.
so I am a test, don't guess girl. And if you time somebody's hormone testing, this is assuming they're still having regular cycles, okay? So if you time the testing to be
Yeah,
between day 19 and 21, assuming they have a 28-day cycle,
yeah,
you're going to catch the progesterone at the highest level because they will have ovulated. Um, and you can calculate the ratio of the estrogen to progesterone to see if they're estrogen dominant. And then from there, you can figure out what to do if there's a huge gap there. If I have somebody who's got pretty regular cycles, but they're kind of a little all over the place, I'll have them use an ovulation predictor kit to
mm,
catch the LH surge and then test 5 days later.
right.
And there are many ways to test. There's saliva, which I used to use, but I don't anymore.
Yeah,
There's the Dutch test, which is a urine test, which gives you just this wealth of information about not only your sex hormone levels, but how your body is breaking them down.
yeah,
And I love that because if somebody's hormones are going into a pathway that increases their cancer risk or they're less likely to eliminate them effectively, I can do things to manipulate that pathway. And then there's also serum testing. I'm fine with serum testing. I can use that. Um, but this whole business of, it's not going to provide us any useful data because they're fluctuating minute to minute and blah, 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 blah. Well, if you've ever worked with a diabetic patient and had them do a finger stick on each hand at the same time
yeah,
and come up with two numbers that were different, you know that yes, things fluctuate, but we use them to make clinical judgments all the time.
yeah,
And so we know that having an estrogen level above 60 is bone protective. We know that having it over 100 is going to more than likely get rid of all of your hot flash symptoms if that's something that
yeah,
you're struggling with. We don't really know what levels provide cardiovascular protection or brain
yeah,
protection necessarily. But so many doctors are just basically saying, here, have a patch, here, have a progesterone pill at 100 milligrams, which is kind of like a drop in the ocean in my book.
yeah,
Um, and they just send people on their
yeah,
way.
yeah,
Maybe their level gets to 20.
yeah.
Well, their symptoms may get better, but are they getting the full benefit? And there was a study published, might have been 3 months or so ago, where they looked at the rates of absorption that women got from estrogen patches.
Yes, I was going to ask you about that.
20% of women were not absorbing the estrogen from their patches to a degree that was going to do them any good.
Yes.
And I'm
Yeah.
like, well, you think
Yeah.
maybe we ought to check?
Yeah, and so this is also why I think testing is critical because you could be taking your HRT, but if it's not absorbing, and as you mentioned about the Dutch testing, if it's not actually converting, if it's not going into the cells and doing what it needs to do, it's great that you're getting it, but once it's been absorbed through the skin, assuming it's being absorbed through the skin, is it going along the pathways it needs to go along to do what it needs to do in the body?
Right.
Otherwise, you're just literally sticking on a patch and, hoping for the best. But I think dosage is critical. I think application is, if you're using a cream, for example, how are you rubbing it in? Where are you rubbing it in? How long are you rubbing it in? Are you just sort of putting it on like a hand cream? Or actually, are you spending the time to actually allow
Right.
it to absorb into the skin? So taking HRT sounds very like great, magic bullet type of thing, but it is way more complicated than that. And I don't think that conversation is being had. I don't think women are really aware that there is a big, nuanced, important conversation that we need to be having if you decide to go down the HRT route, because it is slightly more complicated than just putting your patch on and everything's amazing.
Well, I had a conversation with a friend of mine. I went out to dinner with her last week, and she had done a saliva test at one of the compounding pharmacies, and she had the results in her purse. And she's like, "Would you mind looking at this?" And well, she'd been on topical progesterone, so her level was sky high. So it's not valid to make any sort of decision on. But her
Yeah,
estrogen was low, and she had symptoms of low estrogen, and then over the weekend, we continue to have some text conversations, and she's like, "Well, I'm going to get a patch and I'm going to pick it up right now, but I really like my baths every night. So is that going to be a problem?" And I'm like, "Well, it's only a problem because if you're in hot water, the estrogen gets released more quickly from your patch. So
yeah,
you might be better putting it on the back of your arm." But nobody's going to talk to her about that unless she brings that up, if they even know
yeah.
that hot water makes it get released faster.
Or if they would even ask her, where are you applying the patch?
Right. Well, everybody says, "Oh, you have to do it below your belly button and blah, 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 blah." No, you don't have to.
Yeah, yeah, yeah.
Don't go
Yeah,
on in
no,
your skin.
I think it's really important because I think we are hearing these very monotone or very siloed conversations. As we said at the beginning, there is so much more conversation around menopause. Women feel less alone, but I question whether they feel more confused.
Well, and then there's this whole camp of physicians who, where they got this information from, I don't know, but that you have to have not had a period for 12 months before you can even go on any hormones. And I'm like,
Yeah,
what?
yes,
Where
yes.
did that come from?
Yeah, yeah. Well, now also you have in the UK where HRT is being promoted as gold standard protocol. So if you're not, it's so interesting how the pendulum has swung so
Oh,
far
yeah.
the other way. If you're not on HRT, then you are doing something wrong. And if you're not on HRT, you're not serious about your health and well-being.
Yeah, and that's just not true. I mean, um, you may just have to make more effort around the lifestyle piece, but it's such a personal decision. And I'm all about meeting people where they are, and what's right for me may not be right for somebody else, and that's fine. Um, I'm glad to see the pendulum has kind of come back the other way, but there's still so much 2002 thinking out there. It's still everywhere.
Yeah.
And I will say I gotta tip my hat to the UK because as far as menopause in the workplace goes, y'all
Yes.
are so far ahead
Yeah.
of, of
Yeah.
the United States.
Yeah, yeah. And I know there are annual awards and conferences and all different things. And there's so many now training programs out there. So, yeah, that definitely is something great. I want to ask you about women advocating for themselves. So,
Mm-hmm.
we're now entering a situation where often the women are more informed than their healthcare providers. Often the women have, the 2002 narrative still does sit quite strongly with healthcare providers unless they've done their own further education, unless they have been, done their own research looking into the menopause societies and what, the recommendations are today. There still are so many doctors who still are hesitant to prescribe HRT, but even those ones that, are not in that negative, HRT equals cancer camp, women today are more informed. So, how do
Mm-hmm.
you see this sort of women really being able to advocate for themselves? The health, this sort of dichotomy between the healthcare system and the women that it needs to serve. How are you seeing that play out?
Well, so one of the things I do with my clients, if they're hesitant about having a conversation, is I'll actually tell them the exact words to say. And
Yeah.
generally, what I will suggest that they do is present it to their doctor as an experiment. Hey, can we try this for 3 or 6 months?
Right.
Um, my reading, this is what I've learned in my reading. Don't go in and say, "Oh, I was on Google and here's what I learned," because that basically shuts down the conversation immediately. But
Yeah.
if you are reading and you have articles and you share that information, granted in a 7-minute visit, nobody really wants that to happen, not the doctor anyway.
Yes.
But I think the advent of the online telehealth hormone platforms, even though it's very cookie cutter and protocol driven, it's giving women another avenue to go down. If they meet resistance from their own physician, I'll send them to like MIDI Health or whatever in a
Yeah.
second, because it's $250. They take some insurances. It's almost guaranteed that they'll come away with a prescription for what they need. And if they've got test results in their hands, because MIDI and most of those platforms won't do testing, uh, then they can at least have some evidence to say, hey, this is what my testing showed. So we've
I
got.
also think sometimes it can be helpful, as you said, no doctor, and it's so interesting because you'd think that doctors would be really excited about proactive patients, patients who are really interested
Oh no.
in taking their health and wellness into their own hands, but doctors do not like that. But I do think that sometimes if you can if you can print off, your local menopause society recommendations, whether it's NAMS or the British Menopause Society or whatever country you're in, if you can print up their recommendations and say, like, this is not my Google research, these are the national recommendations in our country. What do you think about this? Can we have a conversation around this? Sometimes you'd like to think doctors wouldn't feel offended by that type of behavior.
Well,
It's
I think
hard.
the newer generation of doctors are less uh, easily offended, and hopefully they're getting taught some of this. I'm not sure that they are, but I think the older ones who are sort of ingrained in their traditional practice patterns, they don't have any incentive to go out and learn about hormones, right? They've got 2002 in their heads, even though it's 23 years later. And they're unlikely to change the way they practice, or they're uncomfortable prescribing it. And I think, one of the best things a doctor could say to a patient is, hey, I'm not really comfortable with this, but my colleague XYZ is much more knowledgeable. I'm happy to refer you over there.
Yeah.
Or the other thing women can do, this is a great thing to do, is go to a compounding pharmacy and ask who are the doctors in town that
Mm.
know what they're doing with hormones. And that's a great way to find somebody
Wow.
really hormone savvy.
That's a great recommendation. That's a great idea, Dr. Anna. Yeah, go to the source of the
Exactly.
treatment and then work your way backwards. That's a great
Right.
recommendation. Okay, we've spoken about so many different things. I feel like I want to talk to you about thyroid, but I'm not sure if we want to go open up that can of worms. I don't know. Do you have anything you want to say or contribute about thyroid and the role that thyroid plays in all of this?
Of course.
I thought, if we talk about adrenals and cortisol, we've got to talk about the
Yeah.
thyroid piece of the puzzle.
Well, so thyroid's sort of the conductor for the whole orchestra. And, if your thyroid is sluggish, everything is going to be sluggish, as my
Yeah,
functional medicine teacher would say. So, if you're constipated, or you're cold all the time, or you're anxious, or you can't sleep, hair's falling out, whatever, it could be your thyroid. And so if we want to keep this kind of in a box,
yeah,
um, most doctors will only check a TSH, and your
yes,
TSH is a pituitary hormone that just basically says, how hard is your thyroid having to work to
yeah,
produce enough thyroid hormone, um, which is T4, the inactive form of the thyroid hormone. So it really doesn't give you the whole picture. You need a full thyroid panel. So what is that? TSH, free T3, free T4, thyroid antibodies, thyroglobulin antibodies, and reverse T3 if you can get it.
yeah,
And that gives you the whole scope of how hard is your brain working? How much of the raw material for T3, the active form, is your body making? Are you converting it to T3 well? Is some stressor that's what reverse T3 will tell you, how much of your T3 is being shuttled off into reverse T3 and is inactive at the um, receptor level. And then the thyroid antibodies gives you clues into whether or not you have Hashimoto's thyroiditis, which is an autoimmune condition, not just garden variety
Yeah.
sluggish thyroid, and has a management that's a little bit different,
And
at least at the start.
unfortunately, so many of our perimenopausal symptoms also mimic thyroid
Yes,
issues. I always say to my clients, just get yourself checked out first. Make sure there is nothing else going on. 99% it's going to be perimenopause, but let's just rule out that nothing else is going on
right,
because there is so much mimicking going on with typical common perimenopausal symptoms and thyroid issues, adrenal issues. There's other things going there. Our body is a complex system. And we do need to make sure that we are ruling out anything else happening because there are so many similarities between all these
exactly.
things.
Well, and the other part, just one little thing that popped in my head, when you're really estrogen dominant, that blocks your thyroid receptors and makes you functionally hypothyroid. So your thyroid test may look, stone cold normal, but you still have a lot of symptoms of low thyroid because your estrogen is so high. So it's helpful to get that estrogen level down, or at least better balance. And
Yeah.
people, they don't think about stuff like that.
Nope.
And
Nope. Yeah.
yeah, so
Because
anyway.
the way the Western medical healthcare system developed, for good and for bad, was very siloed into specialities and really saw the body in these specialities without, obviously, people who have done a medical degree know that the body is a much more holistic, integrative thing. But for some reason, when it comes to the practical symptomology of it gets very divided up into categories, and the
Right.
interactions between things are really not um, explored enough. But that's why we have functional medicine. So that's good for anyone who feels frustrated in there with their regular conventional doctor. Please go find a functional medicine practitioner like Dr. Anna. You will find amazing things happen when you go to a functional medicine doctor. Dr. Anna, you have given me so much of your time. We've talked about so many different things. We've gone in so many different directions. I'm going to ask you as we conclude the question that I ask all my guests. And I think this really will help to sort of summarize everything that we've really spoken about today. And that is, this podcast is called Things I Want My Daughters to Know. What do you want your daughters, goddaughters, nieces, that next generation? I don't know if you've got granddaughters yet. I'm not
I
sure.
do. She's almost 8.
Wow, wow. What do you want that next generation of women to really know? That they don't need to struggle the same way that our generation of women have. So what's that thing that you really, if you could stand on that rooftop and, shout out, what is it that you want that next generation of women to know?
Well, usually I say, so I'm thinking about my 8-year-old. Usually I say, don't suffer in silence because there are solutions everywhere. I think knowing how prevalent the conversation around menopause is right now, I just want for her and, teens now, my daughter's should be 38 soon, good Lord. Um, so she is a nurse practitioner. She's in the healthcare space. She talks about this kind of stuff. But I just want perimenopause and menopause to be looked at as part of the normal aging process and not a topic that we have to have any shame about talking about. And
Yeah,
so that the girls and young women now are prepared for what's coming. Whether it's books or whatever, their mom's talking to them. My mother had a hysterectomy when she was in her late 30s, so she was no help.
yeah,
Uh, and it was just like kind of flying blind. I had no idea. Um, but I have definitely made it my business to have an idea, and I just want that knowledge and wisdom that women are gaining now to get trickled down to the baby girls now.
Yeah, yeah. Wow, we didn't even touch on your book. We haven't touched on your longevity plan that you're now sort of developing for those postmenopausal women. I think we need to have another conversation. But
We
for the
can do
moment,
that.
just tell everyone where they can find you, share your book and where you are on social media and where people can reach you if they, want to connect with you.
Great, thank you. So my website, excuse me, is drAnnaGarrett.com. That's Garrett with two R's and two T's. I'm Dr. Garrett on all of the social platforms. My book website is perimenopause.book.com. It's also on Amazon for people in the U.S. and Canada. Um, yeah, that's where you can find me.
Amazing. Amazing. Thank you. This has really been amazing. I know that we agree on so much, so I hope that the people listening feel that they, didn't just listen to us in an echo chamber, but that they have been educated and informed, and that we did try to, push the envelope a little bit in our conversation. Really, bring to light some of the things that are being talked about and to shed light on thinking about things in a different way. I know that's one of the things that you really are doing in your work, so thank you so much for joining me. I've loved every minute of this conversation, and to everyone listening, please feel free to reach out to Dr. Anna. Be in touch with me. Let me know how you found this conversation, and I look forward to seeing you at another episode of the Things I Want My Daughters to Know podcast.
Well, thank you for having me.